Welcome to our virtual Just Walk Talk. We appreciate you taking the time to listen to us today. My name is Jodi Dickmeyer, and I'm a pediatrician at Children's Mercy in Kansas City, Missouri. This past year or so has been extremely difficult for all of us. We, as healthcare providers, want to be here for you and are trying to find new and creative ways to reach out to our patients. Due to the current COVID-19 pandemic, it is not safe to meet in large groups in person, so we decided to bring a virtual walk to you. Please grab your tennis shoes, your family, and listen in on a few pediatric topics. I want to discuss a few general pediatric topics before moving into talks with some of our subspecialists. Today, I will be talking about 1, the importance of exercise and how to incorporate it into your everyday life. 2, the importance of annual well child checks. And 3, recommendations about the annual flu vaccine. So let's start with the reason we are all here, to be more physically active. We know a lot about the importance of exercise as far as trying to stay healthy and preventing diseases such as high blood pressure, diabetes, and elevated cholesterol. But what you may not know is that exercise has a significant impact on your mental health as well. When we exercise, our body releases a hormone called dopamine. Think of dopamine as that feel-good hormone in our body, as it does exactly that. When we exercise enough to make our heart rate beat faster, that's when dopamine is released. This is why doctors recommend exercising enough to accelerate your heart rate for at least 10 to 15-minute intervals, with an overall goal for children to exercise for at least 60 minutes a day. You do not need to perform the same exercise during each of these 10 to 15-minute intervals. In fact, it can be helpful to do different exercises during this time to target different muscle groups. These can include jumping jacks, sit-ups, push-ups, whatever you can think of. And while I know as a working mom with 3 young children that it may seem impossible to find time to exercise, it can be done. Try to think of times in your day that you could set aside 10 to 15 minutes for exercise. If you work during the day, consider lunchtime as a time to get up and move. Or you can try some of my silly tricks, including dancing in the kitchen while making dinner or cleaning up, fitting in a quick workout video from YouTube after picking up the kids from school, or better yet, taking the kids on a walk or playing soccer or playing tag as a family. You will find it truly is possible to squeeze in some workout time. Trust me, playing tag with your kids will definitely get your heart rate up. And if we do it as a family, our entire family gains the health benefits and the benefits of staying connected. We also want to model healthy habits for our children as they look to us to see if it is important in our lives. If I can do it, so can you. As a quick reminder, while I have you on the line, please remember to see your doctor annually for healthcare visits. This is important for both you and your child. As a pediatrician, we like to see your child every year to see how your child is growing and developing. These are actually 2 different things. Growth is measuring their height, weight, and body mass index. Body mass index, you say? Yes, this is confusing. Let me give an example. When we measure weight, we are looking at how your child's weight compares to his or her peers of the same age. For height, it is the same. It plots your child's height on a growth chart compared to the same gender and the same age of your child. When we look at body mass index, this is looking at your child's weight compared to how tall they are. For example, if we have 100 kids, the same gender and the same height and the same age, where would your child's weight fall on that growth chart? This is the measurement we look at to make sure their weight is in a healthy range for how tall they are. If you have questions about that, please ask your doctor, because I know it can be quite confusing. Aside from growth, we ask about development of your child. For younger kids, we track these skills very frequently. These skills include fine motor, which is how they use their fingers, hands, and how they eat. Gross motor, which is how they use those large muscle groups in their body, such as for sitting, crawling, walking. Language, which is when they coo or babble or when they talk. And social, which is how they interact with the world around them. For older kids, we want to check and see how they're doing in school and offer additional resources if needed. During each visit, we also want to be checking in with you to make sure you have everything you need to take care of your child. Of course, remember we're here for all types of visits, so give us a call and schedule your annual visit. And part of the yearly visits includes making sure your child's vaccines are up to date. This includes the annual influenza vaccine, which helps decrease the risk of serious illness. As a reminder, the flu causes fever, cough, congestion, abdominal pain, muscle aches, and fatigue, among other things. These symptoms can be similar to COVID. If you're concerned your child has the flu or COVID, you can call your doctor to ask about testing. The only way to know for sure is to test. And the best way to prevent the flu is with the vaccine. And while the vaccine is not 100% effective against preventing the flu, it does decrease your risk of severe illness. As a reminder, the flu vaccine is a killed vaccine, which means it cannot give you the flu. Some people complain of achiness, a sore shoulder, or fatigue, sometimes even a slight increase in temperature. These are common reactions after the flu shot and are indications that your body is mounting a good immune response to the vaccine. If you're worried about a potential allergic reaction to the flu shot, please ask your doctor before proceeding. It takes about 2 weeks to be fully protected after receiving the flu shot, so please stay ahead of the game and get vaccinated today. Please ask your doctor if you have any questions. Thank you for listening today.